CCDSL and the care agency are working very hard, working around the clock to work through what is clearly a chaotic situation for service users, their families and workers. It's been months of disarray, chaos, confusion that service users, families and workers have had to endure. This has resulted in CCDSL having to come in sort of a rescue mode to try and salvage what has been a clearly mismanaged transition. This is a transition that has been fundamentally mismanaged also by the government, who had accountability for the contract that it awarded. We heard all throughout the transition that the government had mechanisms in place to assure a seamless transfer of services. We heard assurances throughout the transition from the minister that the issues were being resolved, that the problems were being fixed, and evidently those assurances have rung hollow now in the face of CCDSL coming in and, as we heard in the town hall meeting, stating that they are shocked at the state they have found the services in. If the government would have put these mechanisms in the first instance, when the first transition took place, then perhaps we wouldn't have found ourselves in the position that we now find ourselves.
So the Minister for Health and Care has said on various occasions that that Lifecom Care sold a product which the government did not receive, and that early on they said they weren't happy with what they were receiving, and they've now taken steps to rectify it. Rather than looking back at what went wrong, which I think is agreed on both sides, looking forward, are you optimistic that the projected plans and the roadmap for CCDSL is appropriate and will work out?
Well, we can only hope the assurances that are being given are indeed assurances that are going to be met this time for the benefit of the service users and the families and everyone involved. Let's be clear. We want this to succeed because we know how much this service means to the community and how deeply people have been affected within the last few months, because we have spent a lot of time speaking to families, to service users, to workers, and our aim as an opposition is for these services to be working to the standards that the community deserves.